by the nurses and nursing professionals, and we highlight their work. As we all know that Florence Nightingale was the pioneer of nursing profession who revolutionized the nursing care during the Crimean War. And this is the day which is given by ICN to recognize her work and dedication. To put more highlight on the theme and the day, I would like to welcome Dr. Lata Venkatesan, Principal College of Nursing, and our Honorable President, CNRS North Zone, to speak. Over to you, ma'am.
Thank you, Dr. Sushil, for that kind introduction. So, all of us are observing International Nurses Day today. It is celebrated all over the world, and this year the theme is Our Nurses, Our Future. So the theme itself gives us a lot of hope, opportunities, and exploring how we can cross learn from each other and get united and promote networking, partnerships, and achieve goals together. So hand holding is very, very essential. I felt when the theme was there, recently I attended the International Midwives Day, in which the Dr. Balamani was presenting about the success story of implementing NMTA and how they are able to handhold the midwives and how they have gained the patients' acceptance. They said the pregnant women want to see the NPM nurse practitioners in midwifery. They have gained the confidence of the public. That is most important. The public have to say our nurses, our future. We say our nurses, our future. International Council of Nursing also says our nurses, our future, and they have got many multi-country initiatives, and so many universities are coming up with multi-country initiatives. Even part of our national education policy, having the off-campus infrastructure, inviting overseas experts has been planned. All these are aligning with the goals of G20, Y20, now W20 is there. I was also talking in another meeting, we should work on N20, that is how to liaison and partner with other countries and make initiatives together. So that way, Dr. Balamani Bose is here. She will be explaining how they have successfully implemented this National Midwifery Training Institute concept and gain the public confidence and make the public to speak that they are confident in depending nurses for the comprehensive care of pregnant women throughout their journey of childbirth. So CNRS North Zone, though we are hardly 6 to 7 months old, regularly we are hosting the program and empowering nurses in the area of nursing research, especially promoting evidence-based practice and research utilization. So once again, I wish everyone a very happy International Nurses Day, and all are eagerly awaiting to listen to Dr. Balamani Bose. And we also want to encourage the student leaders because our future is in the hands of the nursing students. So mainly we need to provide platform for the students to showcase their talents, and we must also create opportunities to listen to the expectations of our students. Even when the curriculum is getting revised, I always used to say that we need to take feedback from the students. They are the real stakeholders who will be able to give feedback about the curriculum, which is useful, which has to be retained, which has to be modified. Whereas that kind of approach is yet to be implemented in nursing. We hope in future that also will happen. From CNRS, we can write that students, leaders also have to be involved when we are revising the curriculum and preparing the curriculum. So now the CNRS first time in the country gave student research awards, which nobody has done before. I'm sure the student leaders have joined us today, the awardees have joined us today, and they will share their experience. And they are also here to share what is their vision for future. What do they expect from this profession? So over to the experts. All of us are eagerly awaiting to listen to the success story as well as the expectations from the student leaders. Thank you very much.
Thank you, ma'am, for opening the theme for the today's International Nurses Day, as well as showing the importance of nurses in as a stakeholders in nursing profession. Moving forward, it's my proud privilege to welcome expert of the day, Dr. Prof.S.Balamani Bose, who is presently working as principal in Government College of Nursing and also head of National Midwifery Training Institute, Meerut, UP. Madam is a PhD scholar in nursing and has experience of more than 21 years. She's have experience as vice principal and principal in various positions in government nursing colleges. Her career objective is to be passionate leader in educating and preparing strong nursing professionals, nursing cadre, and provide compassionate care in India as per the international standards. She is holding a strong leadership position in midwifery initiative in Uttar Pradesh and India's first launched public National Midwifery Training Institute in TWH Meerut. Madam is registered with Tamil Nadu Nursing Councils and other councils. She has received Best Teacher Award and other several awards and awarded by Honorable Chief Minister of UP, Gopi Adityanath for Best Mentor Institute. Madam is actively involved in various research activities. She has guided various dissertations for postgraduate nursing students under Tamil Nadu MGR Medical University and Veer Narmada South Gujarat University for last 10 years. She has guided various theses and dissertations under the MGR Medical University and also got approval for the same. Madam has organized and conducted several CNEs program at state and national level. Also appointed as CNE observer by Tamil Nadu Nurses and Midwives Council to observe and report the conduction of CNE programs in various institutions as per the norms of the council. Madam has also published several research articles and actively involved at the national level with various nursing activities. So I welcome you, Madam, on behalf of CNRS North Zone. And now the dais is over to you to speak about the midwifery initiative, which you are sharing and also putting your own experience, sharing your own experience with this training program. Over to you, ma'am.
Thank you, sir, for a wonderful introduction. Good evening, all. An eminent leader who is always to be highly inspired by all of us, Dr. Lata Venkateshan, madam. She even now also she icon of South nursing industry, and Apollo is known for Dr. Lata Venkateshan ma'am, and she is known for Apollo. So whereas her eminent leadership has proved all over the the higher this one. So thank you so much, ma'am, for giving me this opportunity as well identifying, and thank you all. So at present, College of Nursing, NMTI Meerut, College of Nursing, LLR Medical College, NMTI Meerut is the area where at present the NMTI, National Midwifery Training Institute, is being created. Yes. I think slideshow is visible, right?
Yes, ma'am. Now it is on full screen mode.
Yes, sir. Thank you. So the college was started as a school of nursing with GNM course with a seat capacity of 60 and extended to 66 in 1975 in UP, whereas 2012 it has started the BSc nursing course with a capacity of 50 seats, which is under the upgradation of GNM schools into basic BSc nursing by the Indian Nursing Council as well the central government. Whereas in 2017, after the performance, immediately as per the directions of Honorable Chief Minister Yogi Adityanath, immediately the 50 seats were being doubled as 100. And 2018, College of Nursing Meerut was declared as State Nodal Center and Center of Excellence, and 6 weeks training of nursing faculty and pre-service education, all these was conducted. Whereas in 2019, it started the community health nurse certificate course with a capacity of 6 seats. And 2020 selected as National Midwifery Institute. So when the College of Nursing actually, when this sequential milestones of College of Nursing will be understood, have to be understood, since the selection of state on NMTA, National Midwifery Training Institute, under the Midwifery Initiative 2018. So as per the criteria, the College of Nursing, which is having the basic BSc nursing courses and having already been established by the authorities with the skill lab and all this, they were the guidelines for establishing the NMTA, National Midwifery Training Institute. So on the behalf of that, like the Meerut, which is running already the basic BSc nursing 4 years, was selected under the Midwifery Initiative of 2018 and identified one among the 6 sites of NMTA in India. Whereas the assessment for College of Nursing for the NMTA establishment of National Midwifery Training Institute has happened from 2020 onwards, and a sequential assessment like from the GOI as well from the NHM and the state authorities, all that it was going, and the supporting partners are also with it, like especially our supporting partners with JAPIGO, WRI, UNICEF, and SOMI. And FOXI recently have given the policy level supporting and all that. So gap analysis was done and detailed action plan has been made, and a serious brainstorming session was going on for the past 2 years. After that only, that is from JAPIGO and all the other people, and preparedness also was there for about, it's the preparedness started from late 2019. After 2018 Midwifery Initiative has come, and also the College of Nursing Meerut was identified as one among the NMTA, the identified site. So after that, sequential brainstorming and all the preparedness was going on, and on June 24th, the National Midwifery Training Institute was established officially. The inauguration has happened, and it's supposed to be the first ever National Midwifery Training Institute under public sector. Whereas if we see the previous ones, the Fernandez Institute is fully private or governed by fully private organization, whereas Wardha, Maharashtra NMTA is under public-private partnership. So this is the first ever public sector, the whole public sector National Midwifery Training Institute in UP, Meerut. And whereas for the teaching learning purpose, we were being given with 2 IMEs and 5 NMEs, and national midwifery educators and international midwifery educators. So the role of NMEs are, that is national midwifery educators, are directly to involve in the teaching learning part of the national midwifery education, that is nurse midwifery practitioner educator course, whereas these IMEs are created, or IME, the post of IMEs are being created to guide our NMEs in all their aspects, be it mentorship or be it the hand holding and all the principles and all those things. It was meant for IMEs duty. And theory sessions and clinical sessions were being facilitated by 5 national, these are my 5 national midwifery educators as well international midwifery educators. Previously there were 3 international midwifery educators, 1 from UK, 1 from Louisiana, and 1 from Philippines, and at present we have 2. And the NMTA admission was done by the state government through the UP NHM, and actually the capacity is 30 annually, whereas we got 23 NPMAs selected by the UP NHM from 4 different states. This was the first batch of our NPMAs, and they are from Uttar Pradesh 9 NPMAs, from Uttarakhand 5 NPMAs, and from Odisha 6 NPMAs, and from Sikkim 3 participants. So the first batch started on 24 June 2022. And this is the first batch of our students with the IMAs, NMAs, and all the teaching faculty. And regarding the curriculum, the INC curriculum was INC curriculum only is followed, whereas LRP, Learning Resource Package, was made as well. It is now approved by GOI as well. In INC website also it is available. And the theory block was started on 30th June after 1 week of orientation class. And mainly when we think about or see the theory classes, the setup of classroom itself will make understood. It's not a regular theory classes. It is, the classes which is adapting the adult learning principles as well. A different kind of methodology was being used. The pedagogy which was used for the teaching learning purpose is so different, not as like a traditional class or the classical environment. It was fully class or student oriented or the learners oriented. And that is how it was being made, like active participation was there. And even not only internal, we have given them external classes also by the experts. She is our MLCU coordinator, Dr. Yokita, and even medical college people also, they have taken the classes. Like the knowledge was given by various areas or various people. For teaching learning as well, the basic funder or the basic principle in NMTA or else the NPME curriculum is that OSCE. So here, as per the Indian Nursing Council syllabus, the theory as well the practical session should be done maximum only 2 weeks of theory only they are giving. Whereas the maximum part of theory as well clinical has to happen in both skill lab session as well the clinical session. That's what the thing. So whereas an established skill lab is available in College of Nursing Meerut for taking care of the OSCE practices and all. So we have 6 stations: antenatal care, labor room and newborn care, postnatal care, complication management, and family planning and counseling, and infection prevention along with documentation. So this particular skill labs was used for the NPMEs for their OSCE session. And we have established IT lab, and 19 computers with internet facility is also done, whereas it was given exclusively for NPMEs as per the schedule. And we have given them the library facilities also, whereas in this library all the modules which is specifically been given by the NHM, that is available over here. And this is the classroom setup. And actually what the curriculum says that the residential program has to be given. So 6 months of residential program followed by 12 months of mentorship program. So the residential program also was given in the hostel. And this is the theory related, whereas when practical MLCU, that is midwifery led care unit. So the basic reason or aim of this NMTA or the NPME course is that to create a separate midwifery cadre in India, which is in par with the foreign countries, and to establish an independent midwifery practice where possible, and to facilitate the collaborative midwifery care possible. So the basic thing is like childbirth is a natural physiological process, and that should be facilitated. It should not be considered as a disease phenomena. So on that note, midwives are being the separate care of midwife are facilitator or facilitators for the childbirth, as a natural phenomena. So on that note, the MLCU was identified in the area of MLCU was identified in District Women Hospital Meerut with a high case load, somewhere around more than 900 cases per year. That is the basic criteria for establishing the MLCU. And the DWH Meerut, which is somewhere around 6 kilometers distance, was identified and MLCU was established. And this is a setup of MLCU. I would tell you, like so we have an MLCU, and branding also was done. It is the pink which is considered for the branding color for this NMTI. And this is our NMTA setup, MLCU setup, and it's a crash code and all this. This area is specifically for the childbirth phenomena. And this is the reception room. And this is the bed that we are giving to the patients or the mothers as actually. So here you may see that there is no labor room setup. So the thing is like labor is a normal phenomena, and we are facilitating, the midwives are facilitating the labor in the normal cot or the normal bed. So this is the basic thing. And they even any position. And the next one is alternative birthing position. Second phenomena is alternating birthing positions. So this alternative birthing position is on the highest importance of now. The thing is, mother has a right to choose for her own body, which is necessary. So on that phenomena, somewhere around 56 at present till today, 56 live births have happened in MLCU, especially by the independent midwifery practice, whereas all the choices are made by the mothers, and no supine position was obtained, or no supine position was given for the mothers for the labor. All alternative positions, and among alternative positions, mothers have selected semi-sitting as well side-lying position. These are the position usually mothers were choosing. And we have antenatal screening also, which is done. Around 2000 antenatal, more than 2000 antenatal screening was done. And triaging system we used to do. Triaging is that during this antenatal screening, the midwives will be screening the mother with a detailed history as well documentation, and after that they will be triaging high risk, low risk and moderate risk mothers. Whereas a low risk mother and moderate risk mother, they will be handling, and high risk mother automatically immediately from the first visit they will be going to, or they will be referred to the obstetrician. So what happened, this phenomena will be giving a high attention for the high risk mother, so that any illnesses or any complications can be identified at the primary stage itself. Whereas low risk mother will be taken care by midwives as well. Moderate risk mothers will be constantly taken care, and they will be put under the collaborative practices. And midwifery lead care unit, it started operationalized on the 16th of Jan 2023. So in final stages that I would like to discuss regarding the late establishment. And from then 56 births were there. Usually what we do here in MLCU is that completely we are facilitating the physiological birth and non-pharmacological pain relief mechanisms, birth companions, family planning, informed consent, choice of position, hydration, nutrition, and care with dignity and respect with non-violation of mother's and child's rights. These are the things that our midwives are doing. So here we have a glimpse of birthing unit. So this is our MLCU, and this is our actual DWH setup. And this is the area of receiving the mother. So we have midwives over here, and they will be placed over here. They'll be sitting here. And for hydration, there are options for, cooking or all these things, any hot water, everything. It's like a home setup, completely encouraging the physiological birth or physiological process. And this is an oil vaporizer. It is aromatherapy which is given for the mother for facilitating the labor. And this is the peanut ball for encouraging the side-lying position during the birth or birthing process. And the previous one that you have seen, the birthing ball for facilitating the muscle contraction as well, pain relief also. And usually this is the bed, normal bed only we are giving for the mothers. And one more, floor bed is also optional. It is not that all the time the mother have to choose only the cot. And there are floor beds. This is the floor bed even available for mother according to her comfort. And this is for the back massage. and all health education aspect that it is being given, and a separate privacy, and companions will be encouraged to be there along with the mother. Here missing is birthing stools, and now it is under process actually. And we have a crash cart for emergency, this one, and newborn corner is also there for the newborn care. And newborn assessment, everything will be done in this newborn corner. And this is another bed for the mother, whereas for waiting or else contractions, once the labor takes, we will give the privacy, but if she want to be here, like she will be facilitated for, facilitator. So this is an overall view of MLCU. And as we told, like this is, we encourage the birth companions also. So we encourage husbands to be along with the mothers, so that she will be having psychological support as well. He will understand the birthing process also, and breastfeeding, and all, non-pharmacological pain mechanisms, oil vaporizers, and for aromatherapy, all that.
Excuse me, I am not able to hear the voice of this beneficiary mother. If it is possible, please.
Okay, voice is not audible, sir. Okay.
Fine. Yes, ma'am.
Okay. Okay. So this is a feedback of mother that it's already been recorded. I would be sending it, sir, so that we can share it to the participants. So the thing is, like, this is a feedback that is being shared by the mother. Like she expresses high satisfaction with what type of midwifery care that she received during her labor. As well, she is telling that it is her second birth, and she is comparing with that of the previous one also. So she could find a drastic difference between the satisfaction of first delivery, satisfaction that she had in the first as well second delivery. So that is what she is presenting over here, sir. And we go for postnatal also, and postpartum care, all these things. And the next one is the basic of midwifery care is, like, even if we try to have an independent midwifery practice, but collaborative care is always there in our setup. So this is the base for our midwifery practice, because the acceptance, as well as like developing countries like India, the health indicators of maternal mortality rate and infant mortality rate it is under the high surveillance. Like independent midwifery practice is something that we are going to take it new. Whereas when in trial position, if something happens again, the total program will be in collapse. So on that note, collaborative care in a starting trial, collaborative care is must. And our MLCU and DWH, we are completely giving the collaborative care, so that we are successfully doing all the management along with nurses, along with midwives, and even with ASHA workers. And she is our MLCU coordinator, Dr. Yogita, OBG specialized, and all. So we have a collaborative care. And MLCU data at present, over 2,000 mothers have been seen, and as we have already given, like triaging was done, and proper care immediately the care was given. And the NPM is like our learners, 23 learners who were from 4 states. They used to be posted here, and in partial block, in a rotation, that they used to be posted here. And for assessment, formative assessment as per the INC syllabus, formative assessment, The INC curriculum says that totally 18 months of program, whereas first 6 months of program will have a final examination. Before that, 3 months examination has to be conducted, and that will make the understanding whether that she will be able to continue or not. Whereas the 3 months examination also we have conducted, and the 6 months examination was conducted by the UP State Medical Faculty. And right now, one batch has completed the 6 months examination and now on-site mentoring. So the remaining 12 months have to be in mentoring, posting, on-site mentoring. The practical examination, it's conducted. The practical examination has to be conducted in 2 areas or 2 methods. One is DOP, direct observed practice. Another one is OSCE. And both the things, OSCE was conducted in our skill lab, whereas DOP was conducted in our DWH, MLCU. And even they are having the primary health center and community health center visits, and that also was done. And the community orientation program regarding sensitization meeting was done. And the residential 6 months course completed on 24th of December 2022. And examination was conducted by UP State Medical Faculty. And now at present, 1 year mentorship, 12 months mentorship program has been organized. Whereas first 3 months, we have started with the online mentoring sessions. And now the on-site mentoring sessions are being planned, and 16th onwards, the NMEs and IMEs are going for on-site mentoring visit. And the mentoring plan for the whole year has been made as per the IMC requirements or IMC syllabus, and then it is been planned. And challenges. So as with the presentation, I would like to have some discussions on what challenges that or make you understand. First of all, you may think that 2023 they started, 2022 June they have started in June 2022, whereas the MLCU was established only in 2023. So this was the greatest challenge for us, that is guidelines for establishing MLCU and managing MLCU. So here the whole batch, or they have practiced with the labor room setup as well. The guidelines we were striving, but even then, since MLCU guidelines, MLCU consists of 2 areas. One is MLAU, another one is MLBU. Midwifery led care unit has midwifery led antenatal unit, midwifery led birthing unit. Whereas our NMEs and IMEs, along with the learners, they have established midwifery led care antenatal unit, whereas midwifery led birthing unit was recently started due to the, this was the greatest challenge that was faced. Whereas now we have overcome that, because already the strategic plan was over, and soon the guidelines also will be published. As well, we were taking part, we just, constantly we were having communication with the GOI, whereas UP, NHM and policy makers also. And we have made, and finally the NHSRC has come into action, and the guidelines are about to be published. And the first main challenge that is acceptance and acceptance of separate midwifery cadre. So as we have told previously, like it is a developing country like India, acceptance of midwifery as a separate cadre, either by doctors or by paramedical, but even nurses also they have not accepted. We are nurse midwives, whereas there was a phenomena, or there was a threat for all the people. Will a separate midwifery cadre be a challenge to us, or be a competence to us, or will we lose our job when these people come into this one? So sensitization was very much necessary. It is that midwifery cadre will take care of there will be all 3 positions, like there will be separate midwife, there will be nurse midwife, there will be obstetrician. So to make them understand, a separate midwife cadre will take care of low risk deliveries. As well, they will be giving a high priority, high satisfactory care. Whereas there are needed nurse midwife to work collaboratively, that is in the obstetrical led care unit. There are 2 types of midwifery care, the ICM competency they are giving. One is midwifery led birthing, And the second one is OLCU, obstetrical led birthing unit. So both the things will be established for a successful holistic phenomena. Obstetricians are needed, nurse midwives are needed, and of course the midwives, separate midwife cadre is also needed. So this particular sensitization needed a lot, so that now the acceptance of people are there, and they are from even DWH and all the other area, they are voluntarily coming and then telling, madam, how to become an NPM. So this is a success for us, and now we are moving forward with the policy making of enrolling the present nurse midwives into separate midwives. So eligibilities we are checking, and we have already spoken with the UPNHM, and we are finding the ways for this. Is the first success for us. And personnel deficiency, as we said, like we have 5 NMAs and 2 IMAs running MLCU and teaching learning, as well students, as well mentorship. All together it has to be done with the teaching learning process. So it was a little bit difficult, and hope so this and since it is a starting stage, our NMAs and IMAs are working hard, and they don't leave even a single space for anything, and they are fulfilling all their activities. They are striving hard. But soon the UP has identified 19,008 NPM midwives are being necessary, and they are already working on it. 3 SMTIs are being notified very, very shortly, and hopefully this also will be a permanent solution. And recognition and certification. Again, one more, like, this UPSM has played a greatest role in case of certification. On 15th, we are celebrating the International Nurses as well Midwives Day in Meerut at district level. So there they are going to distribute the NPME certificate. That is the first ever certificate that we are going to have in India. So maybe they are going to. So they have a very good role in that. Achievements over physiologic birth 56, as we have noted. In that, only 3 episiotomies. The another main point in case of MLCU or midwifery practice is that never ever we have to do the episiotomies unless otherwise it is highly needed. Go for perineal tear, which is a natural wound, and it will be curing naturally. So here, out of 56 successful live births, only 3 episiotomies was done, which is really a great landmark for our milestone for our midwives. And the NMTI Meerut, along with its supporting partners JAPEGO and WRI, we have formed a district midwifery action group. So district midwifery action group is made at the district level, and magistrate will be the chief role, playing the chairman of this, and all the stakeholders, NMTI and DWH, and all the people will be taking part in that, supporting partner, development partners. So we will be discussing once in every month regarding the achievements of midwifery initiative. So this one will become a greater, this policy making, it will be going to, it will be creating an impact into policy making. And future planning, we are having like INC inspection. Recently, we have attended the INC meeting regarding the INC recognition, INC inspection perform also for NMTI. So we are working on it, and sensitization to all level of healthcare persons, even in common public also it is necessary. And now we are promoting the research activities also, especially care studies we are promoting, and career development of NMEs. We are organizing programs as well, sponsoring also through the development partners, so that the skill upgradation of our NMEs will be done. So these are our road to success. And thank you, ma'am, for a greatest support. You have been an inspiration for all the nursing professionals, ma'am. It's not the face which is very much known for us previously. It is the name that creates an impact, Dr. Lata Venkateshan. So, ma'am, it's really a great honor to be presenting in front of you, ma'am. Thank you all.
Thank you so much. Thank you so much, Professor Balamani Bose, for having very detailed and wonderful presentations on establishment of National Midwifery Training Institute in Meerut, and sharing your story of implementations. Really, it's a wonderful job. You presented very well with the help of beautiful pictures and audio videos and from beginning to end, like how you established this training institute. I really very much impressive presentations. I hope you also enjoyed all the participants.
Thank you,
Madam Lata, shall we take question answer right now or?
Yes. Dr. Balamani, really, we felt like as if we personally visited the midwife-led care units, you know. With the pictures, you have really made us to walk through the Midwifery Institute, I would say. Very clear, detailed presentation. And we are unable to believe in India such initiatives are happening, and we are gaining the confidence of the public. It is not only the theory, practically we have reached to the population. I think this is this kind of approaches are required. Midwife-led, nurse-led initiatives where we are becoming closer to the patient care population, and patients must gain confidence on us. Excellent presentation. Thank you very much. I have few questions, but I will ask at the end. Now the floor is open for the participants. You can post your questions in the chat box.
Thank you.
Ma'am, one of your video that is a midwifery-led care unit, like I also feeling the same, that we are inside the room and you are showing each and everything. So we are although sitting very far from you, but still I felt that I am there in Meerut somewhere in this MLCU, really.
Thank you, sir.
Yeah.
Thank you.
Going ahead, Madam, before taking the questions from the delegates, I have few questions which I came to know, which comes in my mind during your listening the presentations, like what sort of financial support you received from the government side or any other agencies to establish as well as to run and maintain the institution?
So thanks for this question, sir. Actually, the support from the government, when the midwifery initiative we think about, that started actually, if you know, I hope Dr. Lata Venkateshan madam also would agree with it. It was started in 2003 from Dr. A.V. like WHO and A.V. Raman madam from Umayalachi and other people have proposed for it. Whereas if you see, sir, like it is now to 2022 or 2018 that the government has sensitized, or else it has implemented its program. 2018 only the midwifery initiative. So it has taken a long process, whereas we needed a catalyst for promoting or catalyst for speeding up the thing. So there came so many foreign agencies like JAPIGO affiliated to John Hopkins and UNICEF. And now Foxy also is in very keen interest, and SOMI is taking a great part in that. So these people, they are working like a catalyst. They are in different level. They are making it. One is policy level, and WRAI. I missed WRAI, White Ribbon Alliances of India. So these people are working like a catalyst to promote the action or speed up the actions in the government setup. And they are acting in policy level, they are helping in implementation level, and they are complementing the government support. So for example, I would tell you now a mentorship visit. So if I talk about the mentorship visit, sir, we have 4 states people, whereas only you, that is Sikkim, Odisha, Uttarakhand and UP. Whereas when we see the NHM plan, that is financial implementation, PIP, only UP has the plan for or financial guidelines for mentorship visit, whereas all the other states do not have. Now the development partners are supporting even in finance also, arranging and tickets and all those things. So they never give a loophole so that the midwifery initiative will become a failure. So many supports. Even recently we have got the mannequin for OSCE, as the OSCE is the heart of this midwifery initiative, and for practice they have donated the mannequins also. UNICEF has donated the mannequin through NHM. So many supports we are having, sir.
Madam, is there any specific large amount of contribution from Indian Nursing Council or the government of Uttar Pradesh only specific to this training institution, or from central government, Ministry of Health and Family Welfare, specific grant? Just tell us the amount and from where you have received any grant, like 1 crore, 2 crore, like that.
Yes, sir. So actually, according to the this one identification itself, where the pre-service education is given and already been established, this is the criteria to find out. So since the first criteria, we are upgraded from GNM to BSc under the central government scheme, and that was the identified site, sir. And the second one for MLCU and for establishing NMTI, an amount of 10 lakh rupees just for starting, that is initial stage, a lump sum amount for upgrading all these facilities. Like we need to have a separate NMTA room, classroom with all the facilities, all that. So 10 lakh rupees was given. And apart from that, 25,000 of 25,000 rupees for stationaries. So this is the lump sum amount. It was given by the UP NHM through the Government of India. Sir, I'm sorry, your voice is mute, sir. And your voice is mute.
Ma'am, one of
Can
your
you stop sharing the screen, Dr. Bala?
Yes, ma'am. Yes.
ma'am, one of your batches pass out.
Yes, sir.
Yes. Have the successful candidates who have got the training, did they receive any specific placement, or are they still working on their own unit from there they came to you for the training?
Yes, sir. So here, regarding post-state, already Odisha has established SMTI, State Midwifery Training Institute, in the government college, and they have been deputed. And Sikkim also is under process. Whereas in our UP, Uttar Pradesh, 3 SMTIs have been notified. Whereas very shortly, like Kanpur, KM and Varanasi, I believe, and they will be deputed there very shortly. And we have already asked them to give them. I think within 15 days that SMTI inauguration will be happening. Yesterday, day 9th only, the inauguration for Odisha has happened, sir. SMTI.
It means those who receive training from you are being deputed in their respective state training institutions, which might be starting soon.
Yes, sir. Actually, right immediately, like when I want to directly answer your question, we had a challenge. It means since it is a new SMTI, right immediately 24th of December they finished their 6 months program, whereas they have to go immediately to the SMTI. It has not happened. What happened, like since late in SMTI establishment, notification, government process, and also inauguration. So only now they are getting posted. So because of that, we had this many days of mentorship lagging. But that is the reason why we have done the online mentorship. So that is a lag in our program, sir.
But ma'am, I am sure that they will soon be given their respective posting in their specialized area. Your challenges might be finished soon. I hope so.
Yes, already been identified, sir. Then like UP within 15 days, I think so they will be doing, sir, very shortly.
And also I expect that those who are giving special care in this midwifery training institution will get some may get some extra incentive or increment in their job also, which will motivate them to pursue, like more and more nurses will come and join this training.
Yes, to answer you directly this question, I can tell you some financial implications which is given by. So the persons, like the learners who are enrolled in this NPME education or NPM, NPM as well NPME, don't know, educator, they will be given their salary. And apart from that, an incentive of 10,000 will be given to them extra. And the residential program will be funded by the government, NHM, that is through the Government of India. NHM will be funding for the accommodation, food, and even stipend also. So on that note, this is going to be a positive attraction for the learners to get enrolled in midwifery practitioners.
Yes, ma'am. Is there any registration required post-training? Under any from the State Nursing Council or the Indian Nursing Council, any specific registration after this training?
So State Nursing Council will be there taking care of the registration, where after 6 months, it has to give a temporary registration certificate for the midwife. And the format is already given by the Indian Nursing Council very clearly, and that will be given by the State Nursing Council. And after the successful mentorship program, one more examination at the end of 18 months will be conducted. And after passing that 18 months, the permanent midwifery registration certificate will be given to them. And there onwards, they'll be independent midwifery practitioners. They'll be able to do that.
Okay, okay. Thank you, ma'am. Now I'm taking questions or queries from the delegate side. One of delegate posted that who are the birth champions, mother or husband? And is there any outcome of presence of birth champions on progress of labor? Like, what is the outcome of presence of birth champions on progress of labor?
I think birth companions, just to correct.
Birth campaign. Okay, companions. Sorry.
Yeah. So thanks for the question, because again, I just wanted to emphasize when I presented the slide. Since it is a foreign phenomena as well, we are developing an independent midwifery practitioners over here. Usually, even if the mother want the companion to be present during her birth, it is not possible in our Indian setup. Whereas now this respectful maternity care as well, this independent, like this particular NPME course or NPM course, which is based on ICM syllabus, ICM module, is encouraging the birth companions. Whereas surprisingly, we also were thinking about birth companions. Will the gents come into this midwife, labor room, and will they take part, Indian setup? But surprisingly, I'll tell you, they were voluntarily and eagerly supporting. First, they were having fear, basically. There was some, experience also they have shared. Madam, we were very, very scared of, seeing that, because we never used to see that, and we get afraid and all those things. But the satisfaction which is expressed by the mother after experiencing the hand-holding of husband during the labor, it was tremendous. Like, it was experienced by the second delivery mother. Like, she was telling, Madam, first time, no, I felt like as if I'm going to die or whatever. This is primary as. So whereas when husband was there, she had a greatest psychological support. And after that, one more point also that she expressed, I would like to note down over here. In Indian setup, never ever the birthing pain of a mother is recognized by the male. Like, that is what she was telling. So when this is there, the child rearing process, the equal care they will be taking care. So thanks for you, like that they said. So mothers are experiencing a high satisfaction, by having their husbands during their childbirthing process.
Yeah, wonderful answer, ma'am. Next query is there any post created for nurse practitioner midwife in UP?
Already the higher policy decisions have been done, and it is under process. Very shortly, like we will be creating the nurse practitioner, midwife post for NPM post will be created very shortly, and our principal secretary, Dr. Olive Kumar, has assured for it, and soon we will be giving that. And once the post is created, they will be filling it by NHM. At present, that is the present talk which is going on.
Okay, ma'am. The next query is: do you recruit private candidates or only from the government side?
In government of UP, till previous years, only the government candidates have been recruited. Whereas now, the second batch we are expecting very soon. So there is a policy like 50-50. That's what the a policy they are creating. 50% of private people, whereas 50% of government people, so as to equalize the approach or else enrollment of people into this midwifery practitioners will be encouraged. So now this year 50-50. Total 30 people will be 15 from private, 15 from government. That is the proposal. But we will have to wait unless the recruitment order comes.
It means any Indian whosoever in any state of the country can join this course.
Yes, sir. It is like that. It is like that. Whereas now for the second batch, they are planning 50-50. And moreover, they are trying to take from the staff nurses also, newly recruited staff nurses also. So private people can get involved into that.
Okay, okay. So because one of the candidate has posted that she might be from Jammu and Kashmir. So she is asking like how to get the certificate course at Jammu and Kashmir. And is it available online?
Okay. Online education, she is asking. I'm sorry, it's not, because the basic heart of this midwifery training is OSCE and DOP. Unless otherwise you just practice, and it's not going to be possible. And moreover, it's not going to be, proper. So it's not possible to get the certificate online.
Right, ma'am. Right, ma'am.
It's a purely residential course, and it has its own rules. Like you have to have 100% of attendance in MLCU training as well as like it has. So it's not at all possible to get online certificates, sir.
Yes, ma'am. Agree, ma'am. Because your course is totally competency-based learning, so it is not possible through online mode.
Yes, sir.
Yeah, Dr. Lata, madam, over to you for your suggestions and also
Yeah,
ma'am.
Yeah, correct. I think very clearly she was explaining. Dr. Bala, Indian Nursing Council has developed a nurse practitioner in midwifery,
Yes, ma'am.
and already that course is also parallelly running. So how, what is the difference between this course and the nurse practitioner in midwifery course?
Yes, ma'am. Ma'am, there are two, like NPM and NPME, whereas the NPM course is concentrating on to only the practical aspects, ma'am. Like the midwife who is taking care of the clinical aspects, only the practical. Whereas our NPMA, which is given in National Midwifery Training Institute, will be developing the educator phenomena, educators. So here, teaching module, teaching learning principles, management principles, as well the research, all these will be inculcated, ma'am, in syllabus. So both are 18 months course, whereas the content will be different based on the scope of the practices. Either they are going to have an NPME course educator or else NPM. More of clinical and the basic expertise competencies will be there in the clinical setup, ma'am, in NPM. Educator will be concentrating on teaching learning along with clinical expertise. They will be having extra knowledge on teaching learning strategies, management and administration strategies, and research phenomena.
Okay. So, but both are called as nurse practitioners, no? They are also called as nurse practitioners in midwifery. Whereas INC conducts a 2-year program, just like MSc nursing, but with more of practical component residential program. So, but do you think that having 2 different programs with same nomenclature will be how it has been taken?
Yes, ma'am. Here the main thing is MSc, like we have a separate scope of practice. The INC has given a separate scope of practice for this NPME course, ma'am. NPM as well NPME course. So the base, like what INC is telling is that legally they have to be covered. When in India, like developing country, we have to establish an independent midwifery cadre. They have to be safeguarded legally and legally also. So the scope of practice will be saving them in legal issues also. As that, ma'am, am I correct to your question, ma'am? Like, am I answering correctly to your question, ma'am?
No. What is the name of the candidates who are coming out of this program? What is the nomenclature given?
Nurse practitioner, midwifery educator. And next one, nurse practitioner, midwives.
That's what, that is what, no, because this program is 6 months and 12 months handholding. And
Yes, ma'am.
whereas INC has got 2 years full-fledged program, both will be called as nurse practitioners, both will be serving and they both will be in the stream. So the candidates, they will, those who want to become nurse practitioners, which one they will choose? So two parallel programs with same designation.
Yes, ma'am. NPMs and yes,
Yeah.
okay. Oh, yeah, yes, ma'am. Yes.
Because in we have two different programs. That is what I thought. Will it create confusion? Because no, when you say BSc nursing, all
Yes,
follow same curriculum. No, whereas here it is two different ones. Both are called nurse practitioners. And
yes,
your NPMEs, that is educators. You have
yes,
5 educators. Who
yes, ma'am.
trained them? How did they get trained?
Yes. Ma'am, they have got trained in Fernandez Institute, madam. Fernandez Institute, Telangana. And they have taken 18 months course over there, and then only they have been certified like NMAs, like midwifery educators. And they are been, yeah, they have been deputed by the UPNHM to Fernandez Institute for taking that midwifery course.
So they are your faculty members also. Are they involved in teaching other subjects or only NPM?
We take them for MSc OBG as well, 4th year OBG also, ma'am, to keep all the OBG students get updated as well, to be in par with the current scenario. We make them to take classes or OSCE sessions for MSc OBG as well BSc OBG.
But they are your faculty members, isn't it?
They
All
are
5 of them are your faculty members. In addition, they were given training as midwifery educators.
Ma'am, actually, they were not faculty members of our own college previously. They underwent the NPM training from various sectors of, they were recruited by NHM for various purposes, ma'am, like Dutch training and all those things. So they have taken from NHM who were eligible. The eligibility is post MSc, OBG, pediatric and community.
Okay.
So these people, they've been selected and they have been sent for the training, and then they have been deputed here, and after that they became our faculty. Previous
So
to the
pays
training,
the salaries for them? Who pays the salary?
NHM, madam. NHM.
Oh, they are appointed under NHM.
Yes,
NHM pays the salary.
NHM.
Okay. And
yes,
the NPMs who came as students, the 30 participants, they were all from government, so they were drawing salary from their parent organization.
Yes, ma'am. They were
but
drawing.
Their boarding and lodging expenses, who were bearing it?
Ma'am, they were drawing their salary, whatever, like as such. Apart from that, 10,000 rupees per month stipend also they were getting for enrolled in this program. Apart from that, boarding and lodging was paid by their concerned NHM, madam. So PIP, yes. PIP plan was made by the NHM, and the financial guidelines also says that it has to be paid by the GOI. Financial guidelines has been given. I would share it to you, ma'am, very shortly, this financial guidelines. And GO, through that, the NHM has made, the concerned state NHM has made the PIPs and made this fund available for these people, ma'am.
And what about the salaries of the educators? NHM was paying.
Yes, ma'am. NHM is paying. At present, the educator salary is fixed around 80,000 per month, ma'am. And they are getting the hike of increment and all those things in UP. Like 5%, 8%. It keeps on with the scenario, ma'am. But they are getting the increment.
Very good. Okay. Thank you very much. Yeah.
Thank you so much, ma'am.
Yeah. Because of the time, I'm limiting my questions because there is a panel discussion also. Thank you very much.
Yes, ma'am.
Yeah, thank you, Lata madam. And we are really thankful to you, President madam, for giving such a wonderful speaker for the today's evening. And she shared a success story for establishing of this midwifery training institutions. And we asked so many queries to her, and madam beautifully answered all the queries. Salute to you, ma'am, and very big round of applause for you. Thank you so much for joining CNRS North Zone on the International Nurses Day 2023. Thank you so much.
Thank you so much. It was a great opportunity as well, privilege for me, and happy Nurses Day to all. Thank you so much.
Thank you. Now, moving ahead, I would like to invite Dr. Muthu Venkatachalam, Chairperson, Research Committee, CNRS North Zone, and Assistant Professor, Institute of Human Behavior and Allied Sciences, Delhi, for the panel discussion on the theme of the Nurses Day. Over to you, Dr. Muthu.
Thank you, Dr. Sushil, for your kind introduction. And first of all, I thank Chairperson, the President of CNRS North Zone, Dr. Lata Venkatesan, Madam, for giving me or interested me to conduct this panel discussion. Initially, it was suggested by Madam to give an opportunity to all the award winners, which we recently conducted for All India Best Nurse Researcher Award. So we had selected 3 in each of the category of UG, PG, and PhD. And we thought of giving at least first 2 in each category to call and talk about our nurses, our future. That's a theme of this Nurses Day. So we thought of calling them and give an opportunity to talk, and so we hear from their perspective on this theme. So we thought of conducting as a panel discussion. So I thank the CNRS and the President CNRS North Zone for giving me this opportunity. So let us move on to the panel discussion. I request all the panel members, Mr. Manish Theron, Ms. Reshma Rose, Ms. Priyadarshini, Dr. Prasanna, and Dr. Gomadi B to just switch on your camera so that you are visible to the audience. Please turn on your camera so that, okay, fine, good. Okay, so before moving into the topic, let me introduce the speakers today. And all of you know already that they are all winners of the national, All India Nurse Researchers Award in their respective category. So today we have Mr. Manish Theron. He's just completed BSc in nursing, and he got award in the UG category as a second candidate. And I welcome Manish Theron to the panel discussion. Next, let me introduce Ms. Reshma Rose. I could not see, I can't see Reshma Rose. Can you please switch on your camera, Reshma? Sorry, Rima, sorry for that. Rima Rose, shall we have you? Rima, are you there? Okay, we'll see her later. Rima Rose is just graduated from Caritas College of Nursing, Kottayam, Kerala. She's the first awardee of UG category. Then we have Ms. Priyadarshini, who is the winner in PG category, who has completed her PG from Kasturba Gandhi Nursing College from Puducherry. And we have Dr. Prasanna, and who has recently completed PhD from All India Institute of Medical Sciences, College of Nursing, All India Institute of Medical Sciences, Rishikesh, and also she worked as a faculty of nursing from in College of Nursing, AIMS Rishikesh. And we have the winner of the PhD category, Dr. Gomadi Balakrishnan, and she has again completed last year her PhD from National Consortium of PhD in Nursing, and currently working in SOA University as a faculty of nursing. So I welcome you all of you. I welcome all of you for the panel discussion. So the theme of today's panel discussion is Our Nurses, Our Future. Okay, so recently I was, discussing with one of my friend about nursing career. He was straight away telling one of his relative was asking for help in getting admission to their child in nursing. And he said that he has suggested many colleges, and he even helped to find admission with less fee. All those he offered all help possible. At the end, the parent said that my daughter is not liking nursing. So please suggest me some other course. That was the end. He was telling that what is the problem. So this discussion happened only a couple of days before. Then I was wondering, even before entering into the nursing, people have apprehension about the career in nursing, maybe in terms of job or the role of the job, or whatever the reason may be, there is some apprehension about the career. And after entering into that, there is a challenges also. So let us hear from a recently graduated nurse from Nigrams Silang, Mansi Theron. Can you share your experience or your perspectives on the challenges and rewards of a career in nursing?
Good evening, respected chairperson and all the esteemed guests. My name is Manasseh Teron from Shillong, Meghalaya, from the College of Nursing, Negrims. I am a freshly graduated nurse, so I do not have much experience in how a staff nurse works or how a nursing educator works. But I would like to share some things that I believe will happen as a nursing career in nursing career, the challenges and the rewards that come along with it. So as a student, nursing was very difficult. There was tons of assignments and tons of requirements, and also it was very difficult to cope up with the various amount of subjects that came along with it. But I believe that all of this has helped me and trained me and disciplined me and prepared me for a career in nursing. So the challenges and rewards have a delicate balance. The balance, challenge and rewards, I believe are, if we're talking about challenges, I believe that there are two. There are physical challenges and emotional challenges. Like for emotional challenges, I believe that nurses often face emotionally challenging situations when we deal with critically ill patients in the ICU or end of life care for a cancer patient, or witnessing a patient suffering in the various surgical or medical wards. Now, for this, we have to have a very good mental stability. We have to require emotional resilience and the ability to cope with the stress, with the stress of the situation. Also, I believe that because nurses are the first contact with the patient, there is a bond that is built between the nurse and the patient. Now, because of this, we build that emotional connection with them, and when there's a loss of life or when there is a discharge of a patient, there is a little bit of sadness in it. But for this, we have to know that we should experience compassion fatigue, and if there's a burnout, we should be responsible for our own self-care. Now, for physical demands, we know that nurses have very long standing hours. Whether as a male nurse, now as a freshly graduated male nurse, and also in training, I was asked to always help in moving the patient, lifting the patient, or to ambulate the patient. So it takes a huge physical toll if we do it whole day, like for 8 hours or for 12 hours. And also, nurse works in a very fast-paced environment. In all the 6 or 8 hours that we are working, we are never sitting down. We are either working with the patients or we are there documenting, reporting, and recording. So it can be very physically demanding and requires immense strength, stamina, and good physical health. So these I believe are the challenges of a career in nursing. Now, on the flip side, what are the rewards? What are the rewards of having a nursing career? Well, for one, I would like to say that we are making a difference. Now, as a nurse, we go in contact with a patient, and I know that when we talk to a patient and ask about the condition, 50% of their illness is already healed when we talk with them, because healing is not just physical, it's mental also. So when talking to a patient, they are physically healed. So nurses provide comfort and care during these times of vulnerability, making a difference in their well-being. Next, there is a diverse career path in nursing. Now, nurses can work in various settings as a staff nurse, as a nursing educator, as a research, in research facilities, in community health centers. There are in schools and in various fields. Nurses have diverse career paths, and they can go anywhere through nursing. And also there is, and because of the demand of nurses, there is job stability. Nurses will never be unemployed. The people will always be searching for nurses, and because of this, advancements and improvement in nursing always follows. And because of this, and because of the recent, after every 5 years where we have to renew our license, because of the CNE, Continuing Nursing Education, I believe that nurses have the most forefront and the most updated knowledge required. They have opportunities for ongoing education, specialization, and staying up to date with advancements in healthcare practices and technology. And for the lastly, I believe that one other reward is that there is a team bonding and connection formed in a staff nurse or even in hospital. In a high-paced environment, nurses have to work with different people for the optimization of the ward or the school or college. So because of this, they work closely with the interdisciplinary healthcare teams, and they foster collaboration and develop strong relationship with colleagues. Now, this teamwork builds and helps to form good bonds, connection, and friendship. So, in conclusion, I would like to say that again, the challenges and rewards in a career in nursing have both good and bad, the merits and demerits. It is a delicate balance where during the 4 years we will be trained and we will be prepared for the real life work.
Okay, thank you. Thank you, Manish. Just before concluding, I have one couple of questions from me. Then what prompted you to choose nursing?
I would like to say that it was my grandmother. Sir, in my family, my grandmother was the first one who come into medical profession. And through her profession, it has branched out into doctors, into physiotherapists, into pharmacists, and nurses. So I was influenced by my grandmother because she has supported so much of her career, and so look up to her. So I had chosen and decided to follow her footsteps, which is career in nursing.
Okay, fine. Your grandmother is the one who guided you. Now, what do you want to see yourself in nursing profession in next 10 years?
The next 10 years, I would like to be a nursing educator. Sir, I would like to be a tutor or lecturer. I have plans on finishing a PhD, but they will come later after my master's. But in my 10 years, I would like to work in a very good, high-paying environment, like AIMS or where I can settle down and teach, sir. And teach. I want to teach in the future, sir.
Okay, thank you, Mr. Manish Theron, for sharing your perspectives on this. And I wish you all the best for your career in future as a fresh graduate in nursing. And let us move on to Miss Rima Rose. Rima, can you just put on your mic, if not video? Are you available? Right.
Good evening,
Yeah.
sir.
Good evening. Right. So we know that we are in fast-paced innovations in technology now. The recent update in last 6 months or so, you heard about the ChatGPT, artificial intelligence, and recently the bot taking on ChatGPT, and how it influences the students' learning part. I'm not talking about other part, patient care, but particularly nursing education. How much it affects the teaching learning situation, environment, and how it is, whether it is positive or negative. There is a big debate going on. So it is a very fresh pass out. We can hear from an undergraduate student who recently passed out about what are the impact of these recent innovations and technological explosion on nursing education. Let us hear from Rima Rose.
Yeah, thank you, sir. Thank you, sir, for the question. I'm Rima Rose, and I'm just graduated from my college. I'm talking about the innovations and technology in nursing education and its impact. And for over the years, a lot of technological advancements have been used in nursing education. Nursing students are regularly encouraged to familiarize themselves with these innovations so that they make the most out and learn from them. Then the use of technology and innovation in teaching nursing proved that it was indeed valuable in so many aspects, as it provides numerous advantages as mentioned by the several authors. In various researches. And the introduction of clinical virtual simulation, which is a new methodology in nursing education, has the potential to improve knowledge retention and clinical reasoning in the initial stage and over time, and it increases satisfaction with the learning experience among nursing students. Furthermore, clinical virtual simulation can provide a strategy to act as a facilitator of learning. Thus, equipping students with their nursing skills through the use of technology can go a long way in improving the future of nursing. This is a pivotal, as many institutions are slowly shifting and transcending in making nursing education more accessible to all sorts of situations. Also, these innovations and technologies in nursing education are continuously evolving, which is driven by the need to provide students with the knowledge and skills and competencies required for modern healthcare practices. By embracing these advancements, nursing education can adapt to the changing healthcare landscape and contribute to the delivery of high-quality patient care. That's my view about the new innovations and technologies in nursing education. So.
Okay, thank you, Rima. Just a couple of questions from you. Have you ever used a ChatGPT?
Yeah, I've used it.
For the purpose of nursing education or any other purpose?
Yeah, for preparing some notes for my exams, like that.
Okay.
I've used
to be honest,
ChatGPT.
did you use ChatGPT for preparing this speech?
No.
No, I'm just asking. Nowadays, it helps a lot. Even the Google Bard and all, it is even helping getting very latest information on the topic. I'm not talking about anything negative about it, but did you take help of that? I'm asking. Have you started using ChatGPT for the purpose of learning?
Yes. I've used it recently. I've heard about it recently, and that is the virtual reality has unlimited
Possibilities to learn, right?
Yeah. Yes, and they have been
Do you think it
integrated
will
into
substitute teacher or it will supplement teacher?
It can supplement the teaching learning experience, like
Supplement or substitute?
Supplement, actually.
Supplement. It can add value to the already what you are learning from teachers, right?
Yes.
Where you want to be, or what you want to be in next 10 years in nursing career?
I actually am looking forward to work as a nurse practitioner, and I've been driven by this this motivation for so many years while I came for nursing profession, and I really like to extend my career as a nursing practitioner. Yeah, and that's it. I would like.
Thank you. Thank you, Rima, for coming forward to speak. And particularly, I congratulate both Manish and Rima Rose. Though you are a fresh pass out graduate, you took courage to participate in this program and speak among all the, stalwarts before you today, like Dr. Lata Venkateshan, Professor Balamani, and other PhD scholars and audience. And definitely, you will grow in this profession. I wish you all the best. Let us move on to freshly pass out PG postgraduate in nursing, Miss Priyadarshini. She recently passed out from Kasturba College of Nursing, Pondicherry, and she'll be talking on what is the policy advocacy and nursing leadership and its role in future of nurses. Priyadarshini?
Yes, sir. Yes, sir. A pleasant good evening to one and
Put on
all.
your camera so that audience can see you.
1 minute. Sir. Yes.
Yeah, please.
And a pleasant good evening to one and all, and respected dignitaries, and the most blessed to be the part of this Nurses Day celebration along with CNRS, which boosted my confidence to the topmost level. And today the topic given for me is to advocate about the policy advocacy and nursing leadership. So as we celebrate Nurses Day today, I want to take a moment to reflect on a critical role that nurses play in shaping healthcare policy and advocating for changes that improve patient outcome. So since nurses are the forefront of the healthcare delivery and providing essential care to patients and ensuring that they receive the best possible outcome. However, we also have a unique perspective on healthcare policy and the ways in which it can impact on patient health. So when we nurses took part in policy advocacy or policy framing, it will be creating a greater impact than any other profession who is planning over it. And to make it more effective, a great leadership is essential. So by advocating for the policies that prioritize patient-centered care, the most important components which has to be covered inside advocacy is patient-centered care, evidence-based practice, improving the healthcare outcome. Nurses can help to create changes that benefits not only to the patient, but also to our profession. So talking about advocating for the patient, advocating for the healthcare, advocating for the well-being of the patients, quality of the care, etc., etc. And I personally think like nurses fail to advocate for themselves in improving their overall professional growth. They can put some advocacy in that too to make them more flourished. And talking about the leadership, nursing leadership is also the most essential part in healthcare because it sets the tone for the entire organization. To get a great organizational behavior, a proper nursing leadership is essential. So talking about the leadership, it is the ability to influence all the people under their group. So regarding here in nursing leadership, we have a lot of issues in patient care issues, managerial issues, and nurses' personal issues in taking care. So one of the most common issue which has to be taken important role is your shortage in nursing. So this shortage in nursing and the lack of sense of belongingness to the organization, these things are higher. And I utterly blame that it is because of the poor leadership quality of a nursing leader who is in the superior part, who is not taking care of his subordinates, who is not motivating well enough the young budding nurses. So there is a lot of dropouts, and there is a lot of changes regarding that. And it also creates a lot of disparities and inequalities in patient care as well. So to conclude, we have a responsibility to advocate for the policies and prioritize patient care and promote health and well-being of our community, as well as we also need a great influences, great leaders who may put our standards furthermore higher to the greater extent, and to support us like superpower is more necessary for us. Until I personally feel from starting my BSc to the PG, I personally developed myself a lot. But how many of us will take up the opportunity and they will try to come out like us. So for me, there was a great leader who motivated me to do so. And I feel like there should be many leaders who should put forth their students, motivate their students so that they can achieve a lot of things.
So you mean behind every individual nurse's success, there is a leader?
Yes, sir.
Okay. One final question, that what is your perspective on what should be the direction of policy advocacy of nurse leaders in India?
Sir, actually, I'm not sure. I want to know, like, each and every regulatory bodies is being headed by a nursing person.
That
Every
is?
person who's elected, like whoever frames our policies, whenever we are applying for any lobbying or anything, does a nursing personnel is put forth, or he is a decision-making authority?
Okay.
And I think in most of the cases, either the person who is out of our profession being a decision-making authority who make decisions for us. And when it is made by our terms, by our professional, by our leaders, it will be more effective. Comparatively, actually, we know what we suffer from and what we actually need. But I am against that. No leader should be our leaders, like our leaders for our regulatory bodies or anything. For example, I'm basically having a lot of love towards CNRS because all the persons are from the nursing. So it is like, I feel that CNRS will be creating a lot of change ahead. But I think other than nursing professions who is being a great leaders and who is directing us, it is not a good thing.
Okay, thank you very much, Priyadashini, for sharing your perspective on policy advocacy and leadership for nurses. And let us move on to Dr. Prasanna, who is recently passed out from PhD from All India Institute of Medical Sciences, Rishikesh, as well as faculty over there. And just I want to listen to her on nursing research and its impact on patient care. So far, what we talked about, all about nurses and their perspective and their future career and policy. Let us see how nurses can contribute through their scientific research, how they can uplift or have impact on patient care quality. So let us listen from Dr. Prasanna.
Thank you, sir. Good evening, respected seniors, dear colleagues and delegates. So, okay, nursing research and how does it impact on patient care, right? So, as for according to me, whatever the nursing care policies which are made by different like WHO and other Ministry of Health and all, I feel like with the basis of evidence which was created for years together, it has been made. For example, if you take wound care or management of diabetes mellitus patient complications, or maybe the stroke prevention care guidelines or antenatal care guidelines, which are universally followed all over the India. So few examples like this, if we see about all these things, it is made according to the research evidences. And of course, we need research evidence to formulate the policies for improving the patient safety, and also to provide a quality nursing care, and also to maintain the care standards at par excellence or meeting with the global standards, I hope. Along with that, the research evidence also help us for the prevention of disease conditions or maybe disabilities, and also managing new signs and symptoms or maybe new environment situations which we face in clinical area where we stuck up, or maybe like where we don't have the existing policies to manage those conditions. So at that time, I feel we need to take help of research evidences or the published data which is readily available to implement to the patient care and to help them to receive the care comfortably. So here, to take these decisions or to provide meaningful clinical decision-making guidelines, it is important for us to work little harder and also to step forward to generate evidence-based clinical practices, because we are not very habituated to follow evidence-based evidences in daily life, I hope, in clinical side. So here the nurses should have that thought to select suitable researchers, whether they are valid to our present scenario, whether the results are reliable, or the results which are reliable and valid, whether they are relevant to our present situations, and outcomes of the research are valid to our patient conditions. So these few elements are very important to keep in mind while selecting the evidences. And also we need to learn, or we should have capabilities to carefully evaluate available evidences to like a balance between strengths and weaknesses. What are the strengths and weaknesses of published data, and also inconsistencies which is existing, or the bias which are included in the published research. It is very important. So by keeping all these things into mind, we need to very carefully evaluate and select the suitable researchers. And maybe we need to remember, each published data may not be suitable for all the patients. They may not be meaningful for all the patients. So patients are individuals. Individualized care and individualized research evidences are important. For example, if we take like drug administrations, medications, so doctors only, they prescribe for 2 minutes and they go off. Only the nurses need to judge clinically based on the patient condition, whether the side effects of the drug will affect the disease condition to the betterment of the disease condition, or it may lead to the worsening of the disease condition, or maybe by considering into the previous history of drug allergies or any contraindications. So there are multiple dimensions which we need to consider before we could administer any medications. So this is one simple example where the nurses can take help of researches already generated and published. So there is a lot of influence of research in nursing care practice, and also it can help us to practice in better way. But at the present scenario, if we see, the research evidence may go outdated within a few years. Usually we consider 10 years of research may be considered to practice in clinicals. Even while writing research thesis and all, also we don't prefer to include as a review of literature more than 10 the studies published more than 10 years ago. So since that point is also very important to remember, and also it is required for the persons who involved in direct patient care to develop or inculcate the habit of looking at the data which is published, like maybe proficiency, developing proficiency, self-proficiency, or maybe interest towards the research, evaluating them is very important. They may play a crucial role. At the same time, it is important for the administrative support as well as the resources for exploring the available research databases. Maybe all the databases are not freely available to explore the published data. So for that we need administrative support from the institutions, and at the same time patient acceptability also may be playing a very important role to implement research. So and apart from that, nowadays it is happy to share with you that nurses are more involved in generating research evidences, especially the advanced or the highest level of evidence creation, like doing meta-analysis or systematic reviews. They are also like nurses are showing interest to generate these type of evidences. So for me, like I'm hoping for better patient care practices based on the researches which are generated. Maybe following blindly on the guidelines which are formulated years ago, shift from that to shifting into the evidence-based care in daily life. So
Okay.
Thank you, sir.
Thank you, Dr. Prasanna. There are a couple of things in this. Actually, 2 decades before, we largely depends on Western published textbooks was even procedure manual and developing SOP in the ward units. Now there are a lot of research in India, so that helps in developing SOPs and procedure and which practice is better. And there is a difference between research utilization and evidence-based practice. We cannot just implement the research output in the practice. We have to see the cost consideration, resources available, cultural acceptance, patient acceptance, all those things. And I'm happy to even share that in the last decade or so, there are more of nursing research in limelight, and in every published research, even in medical research journals, in every published research, we could see one nurse is part of that paper.
Yes.
That means there are more of a collaborative nursing. Nurses become an valuable member of a team of research, whether it is a nurse-led or a doctor-led research. Nurses are always a part in generation of this data and research evidences. So one last question before concluding to you is that more the qualification of nurse, the larger the gap between patient and the nurse.
Yes, sir.
PhD gap of the PhD nurse and the patient is too far, and a gap of a BSc nurse and a patient is too small. And more you are into academic and you are more into research. So the concluding point is that the researchers are not close to the patient, and those who are close to the patient are not doing research.
They are not researchers.
So how to transfer or how to narrow down this gap so that we can transfer these research evidences into practice more effectively? What your take on that?
It's true, sir. When we are at higher level or more included in teaching of nursing students and training and doing researches, of course, like we are away from the direct patient care. Only we expose when we go for supervising the students, or very little time, maybe like. So this can be. The gap can be shortened or narrowed by maybe by following collaboration between clinical, like nursing education and practice. That can be one solution for this, or maybe like a shift wise, like maybe in a year, 2 months you teach and 2 months you go to clinical, maybe involved in at a higher level of nursing care, managerial care, where we get opportunity to observe the clinical care situations, the kind of patients we are getting, what are the new exhibitions of the disease conditions. We know that
kind of a rotation model that a nurse goes into an academic nurse goes into clinic work for 2 years as a team leader or something in position, come back to college. So you also get more skilled and you can implement what you learned or researched in clinical setting also.
Direct observation can be possible in that conditions.
Okay, thank you very much for your sharing your perspective, Dr. Prasanna. Let us move on to the last speaker today, Dr. Gomati B. She was the award winner in PhD category, and she's recently completed PhD from National Consortium for PhD Nursing, and she's right now working as the faculty of nursing in SOA University. Am I right? SOA, Dr. Gomati?
Yes, sir. SOA, Shiksha Anichandan, deemed to be university.
I'm not aware of the full name. That's sorry for that. SOA University, and she's going to address on how the global health challenges in future perspective. What are the challenges we are going to see in near future? Maybe it is due to technological explosion. Maybe due to the recent advancement on more of nursing evidences being generated, and all or like COVID-like situation. What are the challenges before us? As a global health challenges, and how nurses can contribute in that. Let us listen from Dr. Gomati.
Very good evening to Dr. Lata Venkateshan Madam, Dr. Muthu Venkatachalam Sir, and Dr. Susil Maheshwari Sir, and my co-professionals. I thank CNRS for giving me this opportunity, and I wish Happy Nurses Day to all. So move on to the topic. World Health Organization listed the common global healthcare challenges for the future next 10 years, which is developed by public health and policy experts around the world. Those are challenges on impact of climate change on healthcare system, and challenges in providing healthcare to nations in crisis, challenges in making the healthcare accessible to everyone, and the challenges in expanding access to vaccine and the medications, fighting communicable, non-communicable diseases, preparing for epidemics, making healthy food more accessible, and investing in healthcare workers, promoting adolescent safety, and challenges in strengthening trust between healthcare systems and the public, and challenges in preventing antibiotic-resistant conditions, and ensuring healthcare facilities are clean and sterile, and even utilizing modern technology and innovations. So if you are seeing these challenges, directly or indirectly, nurses play a preventive, promotive, and rehabilitative role in all these challenges. So how we can the global health challenges will make the nurses here we are seeing means these are all the global health challenges in the future. So this will make the nurses also face some of the challenges in their profession, such as providing care in under-resourced or chaotic healthcare environment. Really that structures or infrastructures are not strengthened. Then managing the increasing demand for nursing care in the context of workforce shortages. So we know that already now also nurses, we are running shortages of nurses. So this also can be the challenge. Then dealing with increasing complexity of medical therapy and advances in technology, dealing with quality and safety issues in regards to patient as well, nurses safety also, and the challenges providing safe, quality, and timely care also. Okay, so these are all the because of global health challenges, the nurses also face the challenges. What are the key to future success in regards to these challenges? What all the measures can be taken means we can make collaboration across the disciplines and across the borders, or we need to search for solutions to create a sustainable welfare system and seek out the evidence from the best practice. And we need to encourage the nurses to design new ways to deliver care with the patients, and to co-create new ways of tuning into the patient preferences. So nowadays we know that patients are much aware about their rights, so it is very important. Then nurses will also need to adjust, and in some instances they have to lead advances in primary healthcare and new models of care even in the acute care environments. And the global nurse shortage affects healthcare delivery in every corner of the world, as we know, and will require interventions from all sectors of the society. There is also an increased demand for nurses with enhanced skill who can manage the more diverse, complex, and actually ill patients population than ever before after 10 years. And in response to this shortage, global nurses will look for ways to develop nursing capacity in every corner of the globe. Okay, then how we can create a sustainable global nurse workforce to tackle these challenges? Developing countries like India must be more attentive in exploring actions to stabilize and increase their domestic supply of nurses. And they can moderate the demand through strategic investment also. And developing nurse leaders, educators, and mentors will attract more students to this nursing field. So through that we can come across the shortage of nurses in many countries. Nurses are relegated to a second tier, so that need to be changed, and they need to be empowered to be the leaders of their own field and shape it for future generations to come also. So what for this, what nurses can do? Nurses in all settings and roles are key contributors to emerging disease prevention, response, and management, we know. So nurses working in macro and meso system on like all levels bring important expertise and perspectives to healthcare team to plan, implement, and evaluate response to emerging disease outbreaks and epidemics. So in that way it can be dealt. Then nurse understanding expertise regarding the care delivery models, complex system and resources, infection prevention, and control principles and biopsychosocial human needs make them valuable asset as the leaders and members of interprofessional healthcare also community and the legislative. They can make a legislative advocacy preparedness and decisions also. So in regards to this, can nurse really make a difference? Yes. Nursing is, we know that nursing is a people profession, we can say, and nurses desire to connect to the worldwide society, not just their own. I think we will see more people make time for issues outside their current experience and expertise. So these, the information environment, so we know, all are connected with the information. So we live in makes it possible to feel we are engaged with the globe anywhere, anytime if we want to be. And nurses certainly do want to be connected, and nurses are getting involved in the global health, and they are looking for ways to get involved also. So as the nurses, we can make a difference for people in our own country, even other countries also. So in regard to this, my advice is stay active, stay open to suggestions, and look into the world. So finally, nurses are the lifeline of healthcare organizations, we know, but still lack recognition. Concern on this has been expressed by many, but till date, no strong recommendations and visible implementations of laws and policies are seen. So nurses need to take leadership and proceed to participate more at higher levels to bring a change in the existing scenario. Thank you.
Thank you, Dr. Gomadi, for sharing your perspective. I think I take home a message from you that nurses need to empower themselves and develop skill to face the challenges in healthcare, as well as to upgrade themselves to be already, as you pointed out, nurses are the backbone of healthcare industry, so that the strengthening the skill of nurses is more important to strengthening the entire system, healthcare system. So thank you very much for your inputs. And today we have listened from 5 of the awardees, and we talked about the career and challenges in nursing, and what is the impact of innovations and technology in nursing. Then what about the policy advocacy and the role of leaders in nursing leadership, how it impacts the nursing, and what are the future challenges in that, and what is the impact of research in patient care, how the researches by nurses impacts the patient care and improves the quality of nursing care. And finally, what are the global changes in short and long-term basis, what are the global challenges in healthcare, how nurses are preparing for facing the challenges discussed by experts. And I think I conclude with this message. And if any queries we can take, or will, is there any queries? And okay, there is no query in the section relevant to the panel discussion. I think I acted as a question answer for them. And if there are no queries, I'll hand over the session to Dr. Maheshwar, Susil Maheshwar. Thank you very much. Once again, all the speakers who came forward and volunteered to talk with a very, very short notice. I think only last night at 11 p.m. or 10 p.m. I have given you the topic to prepare, and by morning 10 o'clock only the topics were finalized. But still, you are all well prepared and given a very good perspectives of you regarding the topic of your respective topic. Once again, I congratulate all of you and thank you very much.
Thank you, sir. Thank you for the opportunity.
Thank you so much,
Thank you,
Dr. Muthu, and all the panelists. Am I audible?
You're audible. Go ahead.
Yeah.
You're audible.
Thank you so much, Dr. Muthu Venkatachalam, and all the panelists for holding this brainstorming panel discussion on the theme of International Nurses Day, and all played very wonderful job, and many of them shared, especially the youngsters, shared their vision for next 10 years there, where they want to see themselves. Really, congratulations to you, all of you. Thank you so much. Now we are at the end of this celebration of the International Nurses Day. And from my side, I would like to thank our President, Dr. Lata Venkatesan Madam, President CNRS. Speaker of the day, Madam Balamani Bose, Principal Government College of Nursing, Meerut. Dr. Muthu Venkatachalam, all the panelists, delegates, and all the nurses of the world, specifically today, for their support and presence in this evening program organized under the umbrella of CNRS North Zone. Thank you so much, all of you. Madam Lata, if you allow, can we conclude?
I think ma'am is not there. I see left, I think.
Yeah, madam is not here. So that's the concluding remark from my side. Hope to see you soon in some other topic under the platform of CNRS North Zone. Thank you all. Again, wish you a very happy International Nurses Day. Bye. Have a good night.
Yeah. Thank you all.